Welcome everyone to the Friday Research Seminar here in our college. We're really excited to have you join us. We're going to be talking about today updates and new opportunities, and really a chance to highlight some of the incredible work that's happening in the Hallie Ford Center that's really been transformational, incredible growth that we've experienced as a team and as a great center over the last year, 2 years maybe. We have participants here as well as on Zoom. If you're joining us via Zoom, please note that we're using a webinar style, so your microphones are muted. But if you have a question, please use the Q&A feature, and we have someone moderating that, and then we can answer them out loud as we are done. And I think we are also going to, if you have questions for each, we're going to kind of do different sections. And I think our request is, if you have questions, maybe hold them till the end, and we'll try and get through all of our presentations. And then happy to chat about some of this great work that's happening. So my name is Megan McClelland. I'm the director here of the Hallie Ford Center, and I have the incredible privilege to work in this amazing building and work with an incredible team that I just love coming to work with and laughing with and doing crazy things with, and we've just had so much fun. So I want to introduce them. Megan McDonald is the core director in the Early Childhood Core. Jonathan Garcia is our core director for the Youth and Young Adult Core. Kathy Gunter is our core director for the Healthy Eating and Active Living Core, otherwise known as HEAL. And then Shauna Tomini is our core director for the Parenting and Family Life Core. So today we're going to take you on a really lovely, I think, journey, or I don't know if it's a journey, but to explain and describe some of the really recent work that we've been doing here. We have also an updated great slide of our center, which is really, it feels like a house. It feels like a home that we've all been so privileged to be in for the last 10 or 11 years. There's 4 different research cores. I don't want to go too far into this great graphic, because we're going to have each of the core directors talk about their cores and all these great centers and programs happening here. But I want to just highlight all this incredible work that's been happening. We have incredible projects that are happening that are very translational, research oriented within each core, as well as really expanded, I would say, our capacity for translational work in the areas of trainings. We have the Whole Child Training Institute, the Oregon Parenting Education Training Academy. We have annual lectures, the Campbell Lecture Series, the Family Impact Seminar that David Rothwell, who is on our video, I'm going to show. And then the Oregon Parenting Educator Conference. We have yearly events that are happening to really take the work that is happening here in the Hallie Ford Center and around Oregon and really get it out there. We have programs that we do, Being Physically Active Today, the Family Policy Group. We also have interventions and programs that are evidence-based that we have done really strong research on, that we want to make sure get out there into practice. Really important that we're trying to improve that. And now we have a couple of new really exciting big centers within our center, so it's kind of confusing. We have the Aspire Children's Environmental Health Center that Megan McDonald is going to talk more about. And then we have this Early Learning System Initiative, which is led by a team of faculty and other staff around the state and beyond, that focuses, that I'll talk a little bit more about in our video, that talks about really elevating and supporting the workforce in Oregon in ways that are really transformational. Before I go forward, because we have this really great video that we just put together, I want to say a huge thank you to Laura Ariella, who is our assistant here in the center. She has just really put all this together and done great work. I think she's watching this in her office. And also Qinghua Chen, who is the one who did the video that we're going to watch next, with help from our marketing and communication office. So I'm going to do that next. And it works. Housed in the College of Public Health and Human Sciences at Oregon State University, the Hallie E Center for Healthy Children and Families is a research center founded in 2008 with a generous donation from the Oregon philanthropist Hallie E. Ford. Collaboration is a hallmark of the Hallie Ford Center. To foster interdisciplinary collaboration, 4 research cores were created.
In the Early Childhood Core, we focus on optimizing children's development and well-being in families, early care and educational settings, and communities.
In the Healthy Eating and Active Living Core, we work with individuals, families, and communities, as well as policymakers to increase access and opportunities for healthy eating and physical activity for children and families.
In the Young Adults Core, we empower youth to strengthen their development, support behaviors and settings that promote their resilience, and protect them from risks and vulnerability for a successful transition to adulthood.
In the Parenting and Family Life Core, we examine healthy parenting and family life as a strong foundation for child and youth development, and healthy communities as a strong foundation for families.
In alignment with our mission and beliefs, our efforts in the Hallie Ford Center have allowed us to grow our research programs and projects in ways that will benefit the children and families of Oregon and beyond. The Early Learning System Initiative, ELSI, is a statewide center developed in 2021 through an agreement between Oregon State University and the Oregon Department of Early Learning.
The Oregon Parenting Education Collaborative, OPEC, supports parenting educators across the state of Oregon, as well as a network of parenting hubs striving to connect families with free parenting programs.
Red Light, Purple Light is a self-regulation intervention for children in early learning settings.
The BEPA program fills a statewide gap in standard-aligned research for classroom teachers. Our team at the Hallie Ford Center deliver, support, and evaluate teacher training and implementation of BEPA 2.0 across Oregon and beyond.
The Engaging the Next Latinx Youth for Change and Equity Project, empowering Latinx LGBTQ+ youth in Oregon to address social isolation.
The Family Policy Group consists of faculty and students in the Hallie Ford Center and beyond, bridging research and family policy.
The interdisciplinary Aspire team is committed to transforming what scientists know about environmental health risks for children into public health interventions and policies.
The Oregon Child Care Research Partnership is housed at the Hallie Ford Center for Healthy Children and Families as a part of Extension Family Community Health at Oregon State University. The OSU Center for Health Innovation connects the resources of the college and university to our partners in community, government, and industry with the ultimate shared goal of improving the health and well-being of all Oregonians. With the continuous and accelerated growth of our research projects, centers, and programs, the Hallie Ford Center is experiencing rapid expansion and transformation. Our work begins with passion and leads to life-changing results. Hallie Ford Center! Oh, that was great. Good job, you guys. That was awesome. Thanks. You can tell we love what we do. And I just wanted to say also around this statewide center, we have 2 centers in addition to OCHI that the Oregon, I always get OCHI incorrect. Oregon Center for Health Innovation, sorry. Goodness gracious. We also have the Aspire Center for Children's Environmental Health, and then we have the ELSI Early Learning System Initiative Center. So we have a number of new centers and existing centers that are housed within the Hallie Ford Center. And we also have added to that, there's a new inclusion grant, which focuses on children that is piggybacking. It's aligned with our Early Learning Systems Initiative Center grant. And I don't think we're going to talk about it, so I'll just quickly mention that we have a new grant that's $4 million that was also a partnership with the Oregon Department of Education to provide and support services for inclusive practices for children in Oregon. And that is led by Dr. Bridget Hatfield and myself, but really Bridget and also Dominic Paz, who's on that, and Sam Logan and Will Massey. Okay, moving right along. I want to now, go forward and introduce Megan McDonald, who's going to talk about the Early Childhood Core.
Hi, everyone. I was about to say good morning, so good afternoon. My name is Megan McDonald, and I'm the core director for the Early Childhood Research Core. And it's a pleasure to share with you today some of the things that that core has been up to. I've been a member of this core. Well, I've been the director of this core since 2018, partway through 2018, but actually a member of this core since 2011 when I arrived at Oregon State University. And I'll talk a little bit more about that in a second. So our core, so the early childhood core is focused on optimizing children's development and well-being in families, early care, and educational settings in community. And you learned a little bit already about the ELSI team, and there are a number of faculty on that team who are also associated with the core, but there are even more of this. Do I have feedback here? Okay, that's better. You still hear me? Yeah. Okay. Better? Yep. Okay, thank you. In 2020, one of our core members, Sharon Shen, was awarded one of the Hallie E. Ford Center Team Science Seed Grants. The title of the project was Play to Impact, developing the playful state scale for children and investigating the effect of playful engagement in adaptive physical activity intervention programs. So this project resulted in a manuscript. And more recently, it's really exciting to share that Sharon has been able to supplement that with another foundation grant and funding to extend that project. And then you also heard a little bit already about Aspire, the Children's Environmental Health Center. And this group is dedicated to working together to improve children's health and well-being. The efforts are focused on accelerating the adoption of evidence-informed policies, programs, and practices that can reduce harmful environmental exposures where children live, play, and go to school. So notably, there are a number of team members that you can see in this flow chart who are associated with this project, but that it falls within the early childhood core. The two PIs are Molly Kyle and Megan McClelland. Megan, you met earlier, and Molly, you saw in the video. So this is an NIH sponsored center at about $4 million. And I would be remiss not to share that the center currently has pilot projects that are open. So we have about $140,000 in pilot funding available. We also anticipate that pilot funding will be available annually. So I would really encourage you to go to the website and learn more about some of that those projects and that pilot funding and the priorities. Okay, so within the core, we also have a team focused on flame retardants and home environment on children's school readiness. This is also a sponsored project. So funding from this project is from the National Institutes of Health, the National Institute of Environmental Health Sciences. And so where this really started is that chemicals are added to many consumer products to meet fire safety codes and prevent those items from catching fire quickly. Some of these chemicals can accumulate in people's homes. Children are more likely to be exposed to them because they play on the floors. They frequently put their hands on objects and then in their mouths, and they spend a lot of time indoors, especially younger children. So we're doing a study on how these chemicals and early social environments affect children's behavior and development. And so this is our team, our large team for that project. It is also, as I mentioned, a funded project. So it is also around $3.8 million. And I really want to share a little bit about this project and come back to when I initially joined this core in 2011. This project was started with a tiny bit of money sometime in 2011 or 2012, when we kind of all came together with ideas about how we could work together and collaborate. And now we have a center grant. Many members of that team are included on the center grant, the Aspire Center grant, and also a part of this team with new projects and ideas on the horizon. So I think one of the other things that I think our center does and really well is that we're in inclusive groups. We build early collaborations with people, and I think there's a lot of opportunity for mentoring as well within the center. So that is, oops, right. And then there's this slide about that too. Okay, so next up is Jonathan Garcia.
Hello, everyone. And welcome to our partners. I see a few people here who are involved in the Youth and Young Adults Core. My name is Jonathan Garcia, and I joined as the core director just this year. And so it's really exciting to work with people, in this room, and I'll mention a few others that have been involved in our core and opportunities for you to become involved as well. And so as you can see, the goal of the Youth and Young Adults Core is to empower youth to strengthen their development, support behaviors and settings that promote their resilience and reduce vulnerability for a successful transition to adulthood. And the key here is that we are really giving youth and giving them the tools to change their lives, right? We're not doing it for them. We're not claiming we're not being paternalistic in our process. And that's the goal. And I'll talk a little bit more about that in terms of an equity related approach. And so the big umbrella for this core is really thinking about mental and physical health equity as central to addressing the youth development of youth and young adults. And here you'll see a range of people who have been involved in the core in things like our collaboration with psychology to review grants and talk about important opportunities, to talk about topics related to grant mechanisms. And we take turns in that group. I really want to thank the leadership of David Kerr and the faculty in psychology. And that's a really great opportunity for anyone who is doing research on youth and young adults. If you are interested, please let us know, and we'll send you the invite for the grant review workshop that's ongoing at least every month on Fridays at 3 p.m. But let me know, please reach out. And so back up to the top, you'll see a range of faculty who are involved in our core: Peggy Dolcini and Joe Catania on issues related to HIV self-testing, John Geldof with positive youth development, Jessica Gorman with cancer survivorship in young adults, Cynthia Mojica, who does work with HPV vaccines and cancer prevention, Carolyn Sakuma on tobacco use prevention, Sunil Khanna, who has recently joined our group for grant review, who does work on sexual and reproductive health and IPV in Botswana, and myself, and I do work on social isolation and HIV prevention. And so the other thing that I'd like to highlight in these collaborations is that recently Kate McTavish and her class on adolescent development has been reaching out to faculty who do work with youth and young adults and interviewing them for profiles so we can talk about their work and their equity related work on our website, so students and faculty can become associated with our core in these various ways. And so I'll try to describe these various highlights briefly. The first one, you saw it in the video, it's the ENLACE program, the Engaging the Next Latinx Allies for Change and Equity. And that was funded by the Robert Wood Johnson Foundation. And this was carried out in partnership with Outside the Frame, which is an NGO that's based in Portland, Oregon. And their goal is to train youth to amplify their stories. So they train youth to be directors of their own videos. They train them in all aspects of creating, editing, and telling stories, scripting, storyboarding, all those things. They worked with us and the group of Latinx and LGBTQ youth to create telenovela-inspired videos that were then used to train Latinx peers within 4-H. And so 4-H Outreach Leadership is also a key partnership, especially Mario Magaña in that project as well. And I'm very happy to say that our partner, Ricardo Contreras, is here. He's our partner in Jóvenes en Acción, led by Casa Latinos Unidos, which has been a key partner in various projects, this one as well as the Transforming Academia for Equity program. And the Jóvenes en Acción is actually funded by the Oregon Health Authority. And in that project, we're training youth to do participatory research where they develop their own questions, they collect data using engaging approaches like photo voice, and then analyze that data to tell stories about things they care about. And so again, the goal here is to amplify their voices, talk about things they care about, and come up with solutions in their own words. And so as I mentioned, the Transforming Academia for Equity project, part of the goal of that project is to really realize the land grant mission through partnerships, key partnerships in family and community health and We have Allison Myers as part of that team. We have Marie Harvey as part of the team, and Ricardo is also part of that team. And actually our collaboration in Jóvenes en Acción grew out of that participation. And so we'd like to see like the fact that we meet people that we're interested in working with, and these like pilot grants and these opportunities grow in fruition into bigger projects. And I think that's been the story from what I hear in other cores as well. So if you're interested in participating and growing something together, that's something we do. And then the last thing that I'll mention is the developmental antecedents to HIV pre-exposure prophylaxis. And that was one of the teen science grants that was funded by the Hallie Ford Center. And that grant, the team includes myself, Erika Carrillo, who is a student in global, a PhD student in global health, Peggy Dolcini, Joe Catania, and another student, Ashley Schuyler. And a couple of organizations have helped us to reach communities in that project, including the Cascade AIDS Project in Portland, Oregon, and Familias en Acción, which is focused on the Latino community. And so, as you can see in this picture, these are some of the youth that participated in the INLACE program in our video making workshops. And so, as you can see, there's a lot of passion in our core, and if you're interested in participating in our grant review or in other ways, please reach out to me. And I'll pass it off to Kathy.
All right, thank you. I'm happy to have the opportunity to present. I am a little disappointed in my team because we discussed jazz hand transitions and nobody is participating. Well, we're gonna have to make up for it, so we will do it at the end. So faculty who identify as HEAL Core tend to focus on physical activity and healthy eating behaviors, but we also study the environments and the policies that influence those behaviors with the intent to ensure that all children and families are enabled to eat healthfully and be physically active. So core efforts span the research, practice, and policy realms in a symphony of efforts. And historically, the core has garnered about 7 million in grants and contracts, but a lot of those contracts are service contracts for trainings that evolved out of products from some of those funded grant activities. We've had 2 core faculty become new NIH investigators on core initiated grants. And core projects have enabled a lot of opportunities for postdocs, graduate students, undergrads, and those take a myriad of forms. Notably, students get engaged with state agencies like Oregon Department of Education, and of course, with extension faculty across the state. Core outreach efforts, which is a real big part of our core, and actually all of the cores. It's a hallmark of the Hallie Ford Center. Hopefully you're hearing that message over and over again. But we've increased statewide capacity to implement evidence-based physical activity promotion strategies, particularly in school-based settings. Core faculty have trained well over 500 practitioners to deliver evidence-based interventions, but also to use tools to assess the quality of community and school-based food and physical activity environments. And some of the outcomes of that have been over 50,000 youth in Oregon, for example, have gained access to new physical activity opportunities. So we're really proud of that. Just to highlight a couple of key projects. One is the 4-day school week project, which is currently ongoing. And you've heard about the flame retardant study, which took several years to gain traction and ultimately seeded and flowered into an abundance of grant funding and impacts and outputs. And I hope that the 4-day school week project is sort of the HEAL Core analog to that. And the project PIs are Emily Tomeko, former OSU nutrition faculty, now at Montana State, and Paul Thompson, who is an economist in CLA, and then John Shuna in kinesiology, myself, and Jason Ward, who is with Rand Corporation. And we actually were runners up on a large Robert Wood Johnson Foundation grant that we lost to Rand. So we thought if we couldn't beat them, we'd ask them to join us. So far, so good. Currently funded by the Spencer Foundation and NIH. The project aim is to really understand the effect of reduced school exposure via the 4-day school week model on a variety of outcomes. So we look at some big data, looking at maternal participation in labor. We're also doing that through focus groups and communities with families experiencing 4-day school week models, physical activity behaviors, physical education provision, food insecurity. Academic achievement is a big one. And actually just today, we heard provisionally a paper was accepted that we collaborated with the early childhood core using data from Megan's kindergarten readiness project and looking at the effects of being in a 4-day versus 5-day model. So really interesting outcomes. I want to highlight our team science awardee as well. That was Will Massey, who was funded to implement an intervention to enhance recess quality and increase physical activity and self-regulation among elementary students, heavily disrupted by COVID, but positive outcomes. And Will continues to work with those schools in a variety of ways, not the least of which is to help them navigate social and emotional behavioral challenges as kids return to school. He's also sharing his expertise in coaching through free clinics. Was the first one this week? Yeah. And those are hosted here at the center, but sponsored by Alumni Association and the foundation. So you can talk to Will if you're interested in that. We've also had a core-sponsored Whole Child Training Institute where Doctors Massey, Wegas, and Beamer provided trainings to school personnel about physical activity inclusion, adapted physical activity, recess quality. And you heard in the video, the BEPA program the training program is housed in the HEAL core. And that is an evidence-based elementary curriculum that is aligned to health and physical education standards. And that is something I think is unique, somewhat, not unique, but is a strength of the HEAL core, is that we've had some success in helping faculty to consider how to translate their disciplinary expertise into revenue generating professional development opportunities. So if that's something that's of interest to you, please join us at our next HEAL core meeting and we can talk a little bit about that. And you'll also see going out today the Jason Seeley Memorial Scholarship, which is open to students in the college. And Jason was a student in the kinesiology program. He graduated in 2007, just 4 short months before he lost his lifelong battle with childhood cancer. Actually, I had the pleasure of having him as a student. And his legacy endures through a generous grant from his parents, Bob and Teresa, and his sister, Nicole. So please look for that and encourage your students to apply. And that's all I've got. I'm going to hand it over to Shauna.
Thank you. All right. How's that? All right, thank you. So I'm here to share just a little bit about the Parenting and Family Life Research Core. As many of you know and have felt, families carry the weight of the world on their shoulders. And the COVID-19 pandemic highlighted just how true that is. The pandemic reminded us of the impossibility of carrying the weight of parenting and family life alone, and showed us what happens when families are pulled away from having a physical community of support. It shined light on the holes and inequities that exist in many programs and systems that were supposed to be in place to support families, but were never designed with all families in mind. We were shown the power of leaning into the research that we know on what helps families thrive, and we were taught that what we know can also change overnight. I want to share some words with you that were shared with me recently. I was having a conversation with a teacher and asked about what were some of the lessons that she learned during the pandemic. And I was expecting her to answer something about her classroom. or something about supporting children and families through the pandemic virtually or coming back together. And she shared something else instead. She said, in spending all that time home with my own family, what I learned first and foremost was that I knew where I belonged and that I belonged. And so did my children. And isn't that what we want in so many ways for families? For families with all the diverse forms that they come in, with the unique challenges and the strengths that each carries. All of that shapes what we do in the Parenting and Family Life Core. In this core, we aim to bring together faculty members who explore questions related to how to help children, youth, and adults thrive in the context of their parenting and family life. The programs, systems, and policies surrounding families, and to understand what's working and for whom in the ever-changing context of families and society. Because we've also seen just how quickly that can change over time, whether it's with a pandemic, whether it's through technology, whether it's through one more call for a reckoning with racial justice. I'd like to, in talking a little bit about the core, highlight 2 projects, and then also highlight a few faculty who have been affiliated with the core over the last couple of years, and then also extend an invitation for anyone who would like to engage in these conversations. The first project that I'd like to highlight is the Oregon Parenting Education Collaborative, or OPEC. OPEC connects families with free parenting classes, resources, and events in their communities through a statewide network of parenting hubs. We also have Siskiyou County, California, as an honorary Oregon County along with us in that network of hubs. OPEC was started in partnership with 4 philanthropic foundations, who you can see up here. And because of the strength now and maturity of OPEC and the statewide reach, has become the go-to place for state investment. So Oregon's Early Learning Division, the Oregon Department of Human Services, and just a few weeks ago, we went under agreement with the Oregon Health Authority to bring federal CHIP funds to now support OPEC as well. And so OPEC, we expect in the coming year to grow to a budget of nearly $10 million annually to bring free resources, services, and supports to families. Already, OPEC has reached over 500,000 families through a combination of parenting education series, workshops, parenting supports, and family and community events. And we're excited to see how that grows, along with our ever-growing team that serves to support technical assistance for parenting hubs, strategic planning, professional development for a statewide network of parenting educators, and research and evaluation. Another project that I'd like to highlight is, as other cores have shared, we've been honored to be a part of awarding a Team Science Award a few years ago on strengthening a university child welfare agency collaboration to transform child welfare in Oregon that was led by Brianne Gattari, Kelly Chandler, Laura Kinsel. Several graduate students were involved, along with an advisory committee of additional faculty members. And this project has helped lead to additional partnership and the strengthening of that partnership between OSU and the state with ODHS collaborators, excuse me, that's led to additional and an ongoing partnership in a meaningful way that has the potential to impact Oregon families. I'd like to also give a little bit of a shout out to some of the faculty members who've been affiliated with the core. Not pictured on here is Sally Bowman, who's been core lead and co-lead over the last couple of years. And I reached out to core members to ask about what they might like me to share for them today. So I have my notes to make sure I represent them well. David Rothwell, you'll see he was here. He was also in the video. Through David's leadership and with support from a generous donor, a family policy group was built and started to be a thriving faculty-student group that has been successful building student capacity in policy analysis, with 4 students participating in a leadership role in the past 4 years, along with raising the profile of OSU and the Hallie Ford Center with regular speakers. He's also leading the planning for the 2023 Family Impact Seminar, along with other faculty, many of whom are associated with the core, that's scheduled for mid-February, the The planning is well underway with a topic to be determined in the coming weeks, so please stay tuned. Kelly Chandler is also pictured, who applies a work-family justice lens to study how work affects the health and daily lives of parents and their children. Recently, she was elected as chair of a multi-state collaborative project called Rural Families Speak About Resilience. As the PI for Oregon, she'll be leading data collection with families in rural, low-income Oregon communities early next year. So congratulations on that, Kelly. Brienne Katari is at the OSU Cascades campus, and her work focuses on child welfare, child well-being, children in foster care, as well as their caregivers, and the retention and well-being of caseworkers. Shannon Lipscomb, also at the Cascades campus, and you'll see some of these folks have appeared across multiple cores as their work spans multiple areas. She has work focused on, most related to this core, resilience among young children and their families facing adversity. Megan Pratt, who's often associated with the early childhood core, also sees that connection with her research associated with understanding variation in access and availability of childcare across the state. Bridget Hatfield, a connection to this core with an emphasis on research on relationships, including teacher-child and parent-child relationships, as well as relationships with stress and school readiness, quality of early childhood education, and the implications for policy and practice. Michaela Seckman, who happens to be in the room with us here today as well, serves as the evaluation specialist for OPEC, which I mentioned earlier, as well as the Oregon Child Care Research Partnership. And finally, I want to also name Margie House, who has been coming to core meetings as a faculty member in Extension, Family and Community Health, and 4-H, who I love the questions that Margie brings that really challenge us to think deeply about how research can be disseminated and translated and used to shape community programs and supports. So these are just some of the amazing faculty who've been affiliated with the core. You can hear some of the incredible and innovative research that's happening. We would love to join you to come and join us in community and in conversation. If you are conducting research or working with a team that is and would like to explore these questions, we'll be gathering December 14th, 1:30 p.m. here as well as Zoom. You're welcome to let me know, and we'd love to have you join us to shape and really relaunch and reinvigorate what the next phase of this core will look like. Thank you. I'm standing up here last and getting the applause, but it really goes for everybody over here.
Oh, wait, what are we supposed to do now? I think we didn't do our jazz hands. So maybe look at us right on time. Go team. Check you guys out. Except I'm doing this wrong. This is what happens when you're left-handed. So I don't know if there's any questions, or we could just take any questions from the room or anybody, or we could just talk ourselves actually. DJ.
I was wondering, I'm not sure what maternal participation in labor is. Is that like field work? That's my picture.
So I can give you a specific example because.
Oh, come over here.
So the question was, what the heck is maternal participation in the labor force? Great question, CJ. So I can give you, I just was down in Glide on Wednesday. Glide is in Doug County, and it is off the beaten path of I-5, very much so, scary when it's dark coming back, but beautiful. And we were at Glide Elementary speaking with families and asking them about their experiences in the 4-day school week, which means there's a 5th day that kids are not in school, right? And families have to care for kids or find other solutions. So the question related to maternal participation in the labor force had to do with, does having your children or your child in a 4-day school week influence the decisions that generally moms are making about whether or not to work? And anecdotally, there have been focus group participants who have indicated that the schedule has influenced the decisions that they make related to having a job, balancing the work versus the need for childcare. So that was a long answer to your ask for a definition.
All right. All right. You want to, other questions? Rainer? Everyone to jump in. I will say one of the things I kind of glossed over, but I just appreciated Megan McDonald talking about is just how I think the center has just provided an opportunity for graduates, for students, undergrads, graduate students, faculty, professional faculty, postdoctoral scholars to all be involved at various levels of projects in ways that I think is somewhat, I don't know, it feels unique. I mean, but it's like really an incredible mentoring and training opportunity. We have also our students help us with the real translation of the research. But they're out there. Like we have a large team on our red light, purple light intervention who are out there right now, hopefully working with kids in classroom settings. Hopefully you heard hopefully they're out there. So we have a large randomized trial to scale up our red light, purple light intervention. So those are mostly an incredible, unbelievable team of undergraduate research assistants who do honors theses. They do research projects with our college and with ELSI Engage and other opportunities. And so then they get to talk with graduate students about, because they are working directly with graduate students and postdocs. Well, what's your life like? How did you learn to do this? What do you want to do with your career? And then they're also helping us with the real translational work that's getting the work out there in the ELSI statewide center is quite translational. So we're taking the early learning systems initiative and we're having graduate students help us. And I didn't even mention, so sorry, the team. I should say that faculty team is Shauna Tomini, it's Bridget Hatfield, it's some of these same names keep coming up over and over. You might know Shannon Lipscomb up at Bend, Megan Pratt, and myself. And so it's really this incredible collaborative team. And then there's all these like 15 professional faculty that are embedded in communities around to get this work out there and to take the science of what we know and to really translate it in incredibly meaningful ways that are important for the people in the communities that are from, especially those from marginalized backgrounds and populations for whom we have not been paying attention to. So really trying to take all of that into account to get the work out there. So sorry, I kind of forgot about that. Anyway, I don't want to keep talking. Other questions or thoughts? Marie?
I have to say, there's others. So this might be for Jonathan.
Mhm.
I'm curious to have you maybe clarify. You said the purpose of youth and young adults was, I think, something about you moving into adulthood. So what's your definition of young adults? Maybe they're not moving in, maybe they are in adulthood. I'm just curious if you could expand a bit.
Sure.
For those of us who aren't working with youth, but are working with adults, young adults,
Yeah, great question. I think it has to do with the fact that even though a lot of youth are adults legally, they're able to party and hang out in places where adults can hang out and party, they're still youth in many ways developmentally. They're still part of their families, their youth as part of their families. And so our age range tends to be 18 to 25, although Enlace did work with 18 to 25-year-olds to make the videos and 13 to 18-year-olds as trainees using the videos. And so it was intergenerational in that way. And so youth and young adults means people in transition from adolescence into adulthood, and around age 25 that's when it happens. That's when you start needing to get your own health insurance and you're moving out in some cases. And in some cases, there's diversity in families. There's different ways in which this plays out. For instance, my mother lives with me and I take care of her, and that's perfectly great in Latino communities. And so the ways in which we look transitions to adulthood also depends on our cultural meanings. And so that's a great question, Marie. Yeah.
So we do have one here online.
I was gonna let Jonathan take it.
Oh, I'll
No.
take it.
Or whoever.
You know, you might have to speak. It's, oh, I mean, maybe they can see it. So are there any paid research opportunities in the future for undergrads?
Are there paid opportunities in the future for undergrads?
Because most opportunities for paid research appear to be at the graduate level. So
Oh, yeah, that's a good question. Yes, I think it depends a lot on the project. There's so many different projects happening that if what I think, I will see what you guys think, but my suggestion would be to see what project you're interested in and and then to reach out to a core director, and they can connect you to the project that's within their core. Or if you see something on our website, you can reach out directly to the principal investigator, the person in charge, and find out. It's really a mismatch. I mean, mishmash, perhaps. It's a combination of often it's undergraduate research opportunities that are volunteer, but then you get great experience, and you often get, it helps to get into graduate school to get that if you're interested, or whatever you might want to do. But also there are some paid opportunities also. It just kind of, I think, depends on the project. Would you guys agree with that? Yeah. Yeah. But lots of opportunities, even, at all levels, I would say, for experiential learning, internships, paid, unpaid, volunteer opportunities, postdocs. I mean, Tsinghua, who did the video, it has a PhD in early childhood, but also just happens to have this incredible communication media background, which is really helpful. And so, yeah, go ahead.
We're actually, we just posted.
I think Laura may be posting it right now.
Yeah, we have a student worker position to support outreach and evaluation in the Guild Corps.
Student worker position is being posted as we speak, perhaps, to support outreach and engagement in the healthy eating and active living core. Evaluation research, yes. So, yeah, so definitely lots of opportunities, I would say. Karen.
This is exciting. It's fun to see it all together. So thank you for doing this today. I think my question and an opportunity is, will there be in the future too an opportunity for researchers to want to do a little, learning lab that's right here on campus and be able to utilize Kid Spirit, knowing that we serve ages 2 through 18, but then those 100+ college students who work for us are definitely that older part. So, looking for those opportunities to say that,
yeah,
if you want to experiment or do little focus groups, are there opportunities for us to connect?
I know we've talked about this, and it's always like trying to match up. Like, it's such a really great and incredible resource to remember that we have right here on campus. And I agree with you completely that we really need to consider like thinking with our graduate students for projects and other kinds of funded. I know we talked about it wasn't quite working for the one that we were trying to figure out, but exactly right on. I mean, this is just like low hanging fruit. It's right there. I mean, we should be figuring out how we can work. Absolutely. And I know there's been opportunities. So, yeah.
Just by way of example, it was years ago, but we had a need to test our methods with objective evaluation of physical activity. And Karen was really interested in understanding how active kids were in Kid Spirit so that she could market that. And so it was just this sort of synergy of needs that, resulted in our student researchers working with Kid Spirit kids. And then Karen was able to use those data for her marketing purposes. So it doesn't always have to be like super intentional, but it is such a resource, and we can help each other both ways.
And on average, the child walks 3 miles a day every day when they come to camp. Just to throw that out.
That's helpful. That's good. 3 hours a day when they come to camp.
That was in a cooking class or a science class.
That's great.
Wasn't even physical activity.
Well, let's keep talking. I know, Karen, we need to reconnect because I know we talked a few months ago, and it just reminds me. It's just like, yeah, we got to get back. Yeah, into conversation. And I just want to highlight Tsinghua's back there. She did that great video you all saw. who just arrived. Sorry to put you on the spot, but that was so much fun. So thank you. I think we can use that a lot. Okay, I think, and I just want to end by saying, you know, the center has brought in over $30 million in the last few years. I didn't even say that, but it's just, you can just see this incredible group of people and the people that work here remotely and in our building. It's really expanded in incredible ways. And so we're really excited for next steps and building out all the infrastructure and what we need to do to keep moving. So thank you so much for listening and coming here. And we have some snacks in the back. If you're here in person, please take some. And thanks you guys. That was great.